Welcome to Cloudscapes, your go-to podcast for all things cloud native. Our aim here is to keep it real and have down-to-earth chats about the cloud to also help you learn something new and be inspired on your cloud journey.
I'm Teppo Suominen, your host and a team coach here at UpCloud, and with me as always, my lovely co-host Jannika Jokinen, a senior account executive here at UpCloud. And I'm happy to welcome our esteemed guest today. We've got Johannes Holvitie, the Chief Technology Officer at Oiva Health. So glad you could join us today.
Thank you for having me.
Brilliant. Let's get right to it.
Yeah, so I'm sure there is probably some people who are not that familiar with Oiva Health yet. So maybe we could start a bit off, if you could explain us a little bit what Oiva Health does.
Yeah, sure. Absolutely. So yeah, Oiva Health is a Nordic-based company reaching definitely out to the larger portions of Europe as well. We mainly deliver digital healthcare, social care services. I would say that the two main points are in providing, let's say, especially private clinics with digital reservation, outreach services, forms, these sort of things, the basics of how you can have your clinical visit as digital as possible and as assisted and automated as possible. And then I would say the larger portion of our revenue and business comes from making sure that home care is as digitalized and as efficient and as effective as possible. So we deliver at-home assistance, visits, and all the equipment and services in between, all the way to sensors and these sort of things. So that's mainly what we do. We want to deliver as efficient and as best the tools possible for the actual professionals then to use and apply them in their work to be effective.
Yeah, and I think if we think about, healthcare industry and health tech industry, it's been evolving quite rapidly in the last 5 to 10 years even, that I may be a bit curious to understand if this has been playing some kind of part in where your business has been focusing on, or how has it, changed your business focus and so forth from the start.
Yeah, absolutely. I think the initial goal for us was that we wanted to sort of provide alternative tools or possibilities to conduct the sort of healthcare processes, but really quickly it evolved into the understanding that we really need to do something about the European or let's say the well-being society's mechanisms on how we want to provide care in the future, and at this very moment where we are basically having a rather large crisis of actually having the available assistance in order to keep up with the normal demand. I would say that then after this, it has sort of into our key values, it has sort of come into that we want to make sure that even the single individuals who might have a difficulty in getting the current processes or rather the current care, because the processes can't really yield that to them, we actually can come in there and we can actually offer something that is very attainable. I'm talking about sparsely populated areas like Finland, where a number of people, a huge portion of for example, elderly people or persons who need some assistance live at home, but they don't really have access to healthcare services. So that's like a really core value to us, is to actually level the playing field on allowing these persons to also have that exact same care that they need and they should have.
For sure. You are maybe more of a health tech company, but how much of your work focuses on the healthcare industry in general, or even the legislative and the demands landscape of it, or how much of it is just that you provide the tools for others that they can then?
That's hard to define. It's a really good question.
Bit of both then.
Yeah. I mean, I think 90% of the staffing that we have is obviously mainly concentrated on building and making sure that we are able to deliver our services. But I would say that a lot of the work that we actually do contains some portion of being involved in the political and sort of societal discussions. We are continuously, for example, working with Business Finland and VTT and others on this sort of joint projects in order to understand and deliver the sort of next stage of providing care in for example, the Nordics and how we can actually export that knowledge. We have very knowledgeable businesses and experts in Finland, which we can definitely yield. And I think that's a huge value for us to actually be able to export that more into the European region.
For sure, yeah. And it makes sense to kind of have a test set, what works here, and then try to replicate that and make it work elsewhere as well.
Absolutely. Yeah.
Really good model going back.
Yeah, and then if we think about, obviously we've been working together for quite some time now, that maybe if you could tell a little bit more from the partnership and how everything started between Oiva Health and UpCloud.
Yeah, I actually tried to dig this through. My history in the company doesn't even fully reach into the initial beginnings of our cooperation, but what I've gathered, what I've understood, and what has still remained is that we saw that we need a partner who is actually able to work with us in really defining and delivering a critical infrastructure and the sort of system implementation on top of it that we can still modify while we are running those critical processes for our clients. And I think that was one of the first things where I can't really say where we actually met for the very first time, but I remember from the discussions that this sort of analysis of the market yielded that there's only like very few players, basically you guys, that we should definitely be talking with. Because we had this sort of co-development mentality that has evolved then as the companies have as well evolved.
Yeah, because of course, if we think about also your industry, it's quite regulated. Absolutely. So then, of course, that probably brings certain aspects and even regulations to your technical development as well that you need to take care of when you are developing your software and thinking of what kind of tech stack do you need.
Yeah. Absolutely. So I can't speak for the other elements or industries rather, but I think we are one of the most heavily regulated ones, and obviously Oiva Health delivers on sort of on the 3 nines SLA levels, and we have to be extremely careful about the choices that we make because it is extremely expensive and time consuming. I would rather like to say even because I don't want to implicate that it would pose a risk to the clients in the end. We rather have the risks elsewhere. So definitely it is a huge portion. And then that again sort of demands that we evaluate our partners as well on that and see that there is a similar mentality that we want to resolve things really innovatively, really quickly, fail fast, preferably on the staging side, and then actually go into the production having that confidence on what we have been able to develop.
And it's all security is a trust business, and trust is hard to gain but easy to lose, and especially with healthcare, the trust that you are given is absolute. You're dealing with the most personal data that your customers or the end customers at the end of the day at least are able to have. It's their health data, it's knowledge about how their bodies are working and all that and how their lives are going. So you need to be able to provide that level of trust and layer of transparency, but also the ability to say that, hey, we are aware of how this works. You can trust us with this data. We will keep it safe, because if you lose that, then that's your business.
Fully agree. And then adding to that is that you have to be constantly available.
For sure.
The security and the trust comes first, but then there is also the trust of sort of being available and having the ability to deliver when that is required.
Exactly.
Because you never know when your customer actually needs your services, so you need to be there technically on hold.
24/7.
Exactly. So then maybe a bit more into the regulations in the industry. We discussed a little bit that, of course, HealthTech and healthcare industry in general is really regulated, and of course security and all those aspects with data regulations, data compliance are important. But do you see some other main regulations affecting, your business currently in Europe when operating in Europe?
I think the main ones are obviously that if we are delivering some sort of decision making on human health related matters, we are talking about the medical device regulation. We have components. Obviously, we want to compartmentalize that as much as we can because we want to make sure that the regulation is specific to those parts that are actually involved in the decision making. So that's one. Then the second one is GDPR, by far the biggest one for us. And I have to say that working, especially in the Nordics, we have absolutely differentiating, like highly different interpretations of GDPR. We have certain nations where we see that there is additional regulation that we need to comply with. And then there are nations where we can operate with our own due diligence. And for example, the ISO 27001 is like a very sort of a easy way of ensuring that enough of that data protection side is in place and the sort of quality systems are in place. But still, we see that there's a lot of things that we also have to carry for ourselves. And we are already sort of internally working a lot with the AI Act. We anticipate that there's going to be a lot of regulation coming to that.
Sure.
Currently, we are in a sort of a tie-down situation, or how would you call it, with the GDPR actually not allowing automated decision-making to be done on humans directly. But I would assume that we are approaching a situation where we have to reevaluate that as well, considering the amount of professional assistance that is required in order to keep the healthcare available.
Definitely, at least some sort of assisted decision-making model will be in the cards in the future. Like simply looking at the situation, I think it's just a must-have at some point.
Yeah,
for sure.
Yeah. And if we, of course, think about regulations, it's of course in place to actually make businesses follow certain type of standards and ensuring the end customers that way, that hey, these companies are following the rules and fulfilling the regulations. So then I must ask this from my curiosity that of course there's a lot of regulations. You work with a regulated industry, so do they bring some challenges? And probably so.
They are challenges, definitely, but I would say that they are, at least in my perspective, they are interesting ones in general. I would say that and as a sort of software as a service provider, I think everyone should sort of have the mentality that we want to have the data protection and data security in place. Then the sort of medical regulations, certain decision-making related regulations, as we have spoken of here, they still sort of also provide, they are a challenge where we can also say that from our platform, we could clearly name, 5 to 10 use cases where we could immediately apply machine learning related matters and we would make a tenfold sort of a efficiency value statement to the clients. But it also makes sure that when we develop them, they sort of provide a positive challenge to us in that we have to be really sure about what we would be going for, what we not want to trial, and how we want to formally assess and make sure that those solutions are as safe as the current way of doing things. So yeah, absolutely. But I see it as a positive sort of, it gives us a context in which to work.
Yeah, and I like the mentality of seeing the challenges bringing positive impact to the company, and the way you actually focus on software development and the work around the application level and so forth. So I kind of like that mentality.
Thank you. Yeah, I have to say we have research projects ongoing as we speak on finding those routes for us. So absolutely, we are working on it, and I don't I wouldn't say that we are hesitant on getting them out. I think we are in a verge of bringing the AI into this sort of.
How do you see that in the coming years? That how would the landscape evolve from the regulations perspective?
Oh, that's a tough one. I think the AI Act has faced quite a lot of criticism. I think mainly criticism. I think there's a lot of interesting parts. Why I'm referring to that is that I think my answer to the question is that we will be seeing probably regulation that sort of dissects, maybe takes part of the AI Act and maybe provides more clearer of a context and sort of a structure in how to apply machine learning or artificial intelligence related processes. I'm not sure if it's going to be like industry-wise or some context or process-wise, but that's sort of where I'm currently leaning towards, because I think the AI Act, being sort of a strict but generalistic, needs to have this sort of application context related things that happen on top of it.
You put it pretty well earlier when you said like we're in kind of a holding mode. Like it kind of feels like we've just pulled the handbrake on it for now, and now we're thinking of how we want to move forward in the EU. It's probably coming for sure.
Yeah, absolutely. I mean, I have to sort of, if you allow, I'll take one use case, which is a huge one for us, is that natural language processing, the ability to dissect, understand what is happening, and then provide the structure to either of the parties discussing, and then see what can be taken from that as knowledge to drive other processes is like a immense possibility. Obviously, the implications of what you can do with just understanding the basics of what has been happening would provide a number of interesting automations, and it would sort of delimit on how much currently medical professionals actually need to invest time in just sort of being the integrators, actually just transferring data from a system to another. It is a huge task that takes away time from actually assisting someone who would need the care. So, yeah.
A lot of possibilities there for sure, but we need to release a bit on the brake first.
Yeah. We will be devising interesting things, and when it's time, we'll definitely let go of the handbrake, but easy. So.
Great.
Yeah, and then if we think about a little bit, of course, your role, being in charge of the technical work and overseeing that. So maybe we could touch a little bit more on the cloud strategy and how do you define that for Oiva Health. So maybe if you could give us a little bit of your thoughts on how do you define cloud strategy that fits your company the best.
Sure. Maybe on a very general level, we are obviously interested in continuing sort of the expansion, having possibilities in leaning more on the cloud provider, the sort of platforms that we purchase as services, on focusing what we want to do. We do a lot of support sort of systems development and delivery that we would really prefer to also hand over to a partner that we work with. That would allow us to focus more on the business logic that we think we are especially brilliant in, rather than trying to work on the other stuff that allows us to then actually work on our core things. So that's like the one thing that we definitely want to see services that relate to how we are able to operate the platform on our core system components more clearly. Then I would say already we discussed a lot about the AI. The one big thing for us is definitely going to be the sort of understanding and then efficiently taking into use specialized sort of like hardware access. I'm talking mainly about, like, for example, GPU acceleration for running local like LLMs or any sort of larger artificial models, which again I think is a clear gateway on how to ensure data protection and security while offering
Secure
a critical
models, yeah.
So that is going to be the other part. And then I would say we as a company have let's say I won't say fragmented, but let's say a multiversed sort of a technical background. We use all of the larger cloud providers as well as leaning on our core partnerships. So I think one of our strategies is also to sort of streamline that a bit more. We want to be cloud agnostics. We rely on, for example, Terraform a lot and these sort of things. We want to make sure that we can lean on the infrastructure as a code sort of a principle. We can take the relevant delivery platforms, the production environments, and we want to be able to run them as close to the clients as possible, trying to cut down on latencies and on other production delivery related issues while sort of retaining that general view and the ability to control the entire production and release environment set from like through developing one set of code base, let's say. So those are probably like the immediate ones. Nothing too drastic, I guess, on that end, but those are probably the ones that we want to lean on.
Yeah, and if we think about currently, obviously your strategy is more towards that kind of multi-cloud type of setup, utilizing different cloud providers where there is the best fit. And you just mentioned that you're looking to streamline the overall operational side with automation tools like Terraform and such. So then if you think about the long-term vision for your cloud strategy, that is it more still enhancing the multi-cloud strategy or utilizing public cloud in a different way, or like how do you see that going forward?
I don't think we're really that set on either. I think we're trying to look for the best sort of, obviously the efficient, but then like ensuring our delivery type of a method, and in that I think we're continuously going sort of back and forth on where we want to land. I think the importance for us is to understand that what of our services we can sort of have more centrally available. What are the sort of maybe sort of risk management wise matters that we want to have with higher capacity available, and then we want to have probably much more local sort of access point endpoints to again cut down on certain latencies and other things, sort of to ensure that the user experience is as high as possible whilst retaining the sort of risk of running down on our SLAs. So I can't really say for sure, but I think that we are continuously trying to balance on which would be. But again, like the sort of the cloud infrastructure is developing at such a high pace that's probably also one of the reasons that I won't sort of want to lock that down.
Yeah. Do you see any issues or possibilities on the other side from the hybrid setup with regards to data? Because like we discussed earlier, you're oftentimes touching on quite sensitive data. So does the hybrid setup give you like options or lock you down somewhere?
In terms of like business logic and data management, I think it obviously adds to complexity.
For sure.
And you can then put like backups and everything on top of that. So there's definitely a component of inefficiency there. But in the end, I think the hybrid setup allows us to abide to even the strictest client demands, which obviously we want to be able to do. You can't really penetrate the healthcare context without sort of being lenient on these sort of requirements. And they can really often be like organization-wise just a stipulated fact that you can't really go around. we have tried to do that as well. Not go around it, but have the discussions on what we actually consider to be, for example, an on-premise data setup or whatever. I think the hybrid does indeed add to the complexity, but it's a sort of a business enabler for us. So
we must have in many cases.
Yeah.
All right. Thank you.
Yeah, and then of course, when we talk about, cloud strategy, it usually ties somehow into the whole business strategy, as you were just explaining, that some parts of the data or functions just make more sense to have it on-prem, when in some cases it's, makes sense to use the, cloud resources available. So then if we think about the alignment between, the cloud strategy and then the needs from different departments in your company, how do you ensure, that you're aligned with the cloud and the business needs coming from the other departments?
Ooh, that's probably like one of the hardest topics, I guess, for any company. At least for us, I would say that's the thing that we continuously try to improve in. We develop a very sort of high availability, formally proven system, which often means that we have to have high cycle times for quality assurance and these sort of things. So the sort of sprint lengths don't necessarily allow us to have a back and forth continuously with the business. So I think like for us, the main route has been that we try to make sure that everyone working in the Oiva Health group is sort of fully aware of our vision, the strategy in general, who do we provide the services for and how it is used. We actually have engineers often visiting our clients on the field as well, which is one of the sort of just to get really a touch on how people use our services on a day-to-day basis. But then there's obviously some hiccups that we then have to resolve. But again, as long as we meet the assurance side and we meet the sort of delivery, the availability side of our setups, I think we can often. So we are in a fortunate situation, right? Let's word it like this: that we make sure first that our service is able to deliver the core functions, the all that we have been agreed to, and then we can always look at the well-functioning system and make sure that in the next phases, the next releases, we are able to conduct the changes that we require. So maybe we sort of talk to each other even internally through the service actually. So we have a lot of, we have a decent amount of medical personnel inside the company as well, who act as sort of the change leaders in the organizations who uptake our products. And I think that is also one of these communication gateways that when they use that and our consultants are with them at the field, we actually get the feedback on has something that we have implemented really worked and how can we tweak it even further to provide even enough efficiency.
All right.
Yeah, and I think if we think about, any software, but especially a software that is, such a, important part of people's health, then I think it's actually quite crucial that you can actually get the feedback from the field, because they're actually the ones who are using the product and the service. So then if, you just think that, okay, now it's perfect, let's just chill. And
Absolutely.
Then what if the customers doesn't actually like it?
Absolutely. Yeah. And there is so much facets to a medical person's routines, the way that they work. We can never try to fully understand what they are doing and how they want to be effective in their context. So I think it's crucial for us to really be there and continuously try to pick up on and see for ourselves how the systems are being used. And it is a difficult situation where we are sort of going into a very protected environment as well. We may have to make sure that we are not interrupting anything, but we still want to sort of be continuously present. But I really have to emphasize what you said, that I think it has been the most valuable thing for us to actually be on the field and understand how everything that we do affects even often the processes that we would never imagine that they do.
Mm-hmm.
Exactly. Yeah, and then of course, if we think about cloud and scaling, because of course, when there is for example new customers or something, and you think that okay, how do we scale our environment, and then when we think about the balancing between rapid deployment times and rapid scaling versus, for example, on-prem type of security. So how do you crack that thinking in your process? That how do we balance this out?
Yeah, I think we have sort of two ways currently. I think we want to be looking at doing it just the one way, but currently we sort of have two, where we have let's say a single tenancy sort of a setup where we have really made sure that everything's in place. We can always sort of invoke a new instance on that tenant and make sure that is able to then serve the client as best as possible. So that's one of the scaling methods, and something that we consider very proven and very robust. And then sort of what infrastructure as code, terraforming and everything has provided to us is that we can actually establish entirely new tenants environments really quickly. And I would say that while again that adds a bit into the complexity, it really makes sure that if we are able to hone that to perfection, we can deliver really rapidly, extremely high availability environments, and that is actually the approach that we are now using a lot, and have gotten really good results as well. Obviously, we need to fine tune that continuously, but it is a proven method for us, and something that sort of the scalability is basically limitless for, obviously. So, and also again allows us to be in certain cases where we have a good partner available who's able to support us, we can be closer to the clients as well.
Exactly. Yes. Then let's look into the future a little bit. We've been talking a lot about, of course, how you've been evolving together with the market. But then if we look ahead, what's next for Oiva Health and in your perspective, health tech industry in general?
Well, for Oiva Health, I think we want to hone that sort of diamond, which is our core services. And then obviously we want to take over the world by sort of being able to come in and provide really efficient, really effective tools to sort of assist in this sort of healthcare crisis that we have. I think that's for us, it's really clear. And that comes back for software side, it comes back to quality, sort of the user experience, and the quality and the trust needs to be extremely high. Then for the healthcare side and for let's say the digitalization, I guess on this context, I think in the Nordics, at least sort of at least in Finland, I think there's a sort of battle fatigue of trying to make the digital tools assist us more, and then finding out that we actually are in the end sort of adding the complexity, not making sure that the integrations work, which results into a less efficient process, or someone whose job initially was to actually be involved as much into the content of something, for example, a medical doctor or a nurse, now is actually acting as an relay between information systems or these sort of things, which I think is an unfortunate thing. because it has this sort of a fatigue has come in, but it's also a good thing because then it makes sure that the organizations who need these tools are extremely wary about, can they be really applied? Can they be integrated? What do we need to do and understand from our processes in order to actually apply them efficiently? So I think that would be the first step. And then I guess we sort of, again, go into the sort of renaissance of innovating on top of those digitalized processes. And I think then we probably are ready to also embrace machine learning in some sort of a safe way. And the sky's the limit, sort of, I hope, because healthcare definitely needs that.
Exactly. And I think it all comes down to the fact that everyone wants to make healthcare, better and more accessible and actually make the life easier for the people who are working in the sector as well. But now it's just a matter of the fact that how do we do it in the best possible way?
Totally.
And then companies like yourself are in the mission of making that happen.
For sure. Yeah, for sure.
All right. Actually had a thought about what you were saying about the Finnish kind of battle fatigue. Is it easier or harder to work with organizations who have had many digital transformations gone wrong? Because in a sense, of course, it's harder to get there because they're like, it's just another tool. We don't want this. But once you kind of get into the conversation, they understand this one might actually help us. Like, it's harder at the start, but probably easier at the end. But is the whole stretch, like, compared to, for example, customers elsewhere?
It's a very well put question. I have to say that I am quite biased because before working for Oiva Health, I was actually on the public sector and I was.
You've seen both sides.
Yeah. I think I have my share of fatigue. So I think I am biased in that, and we try to approach and see clients who have had or have not had this, and I think. For us, it's an emphasis on transparency. We try to be as clear as possible on what we can do, what we need from the organization, and if both of these things are not in place, we really cannot actually deliver on the entire promise, and it can actually result into additional work, which we definitely do not want to take place. But I think it's. For us, the answer is transparency, in that we can. I like working with both because I think we get the more, let's say, direct and raw questions from those organizations that have already tried, possibly failed, but at least have learned a lot. And then we can have a really direct discussion on top of that, which often is quite efficient in providing the understanding of what can we do here. But then if we have an organization who might have not implied yet these sort of digitalization measures to a degree, it's often sort of we try to be as educational as possible, sort of in that we have these sort of clients. We often also like to ask these clients to maybe have a discussion with a client who has already had this sort of a transformation. Please, like, share the experience and try to understand each other better. And after that, I think then we can have a really direct discussion. So we prefer both, I would say. But the approach is really different.
Brilliant, thank you. That's, I think, like, very interesting takeaway for anybody who tries to go into these conversations to have with customers, that you kind of have to consider the situation the customer is in. Like, one template doesn't fit all.
Yeah, for sure.
Is it time?
It is time.
All right. For the end of the episode, we have a set of a few short questions you can answer with a few words or a sentence. Don't think about it too much, whatever comes to the top of your head. These might surprise a bit, but let's hope they're easy enough to pick up on. A total of 4. What's the cloud trend you see currently emerging in Europe that interests you the most?
Specialized hardware.
All right.
Interesting.
Usually we take this as this, but I have to ask why.
I think
It's a great answer. That's why I'm asking.
we have seen the sort of breaking of the general AIs, the large language models. We are now seeing how fast they can be scaled down. I think specialized hardware demand is going to explode and will be extremely interesting.
All right. Thank you. Really interesting answer.
Yeah, and then to the next one. So when you're not navigating the cloud, what would you say is your favorite place on Earth?
Renovating houses with my wife.
Interesting.
Brilliant. All right. What is the one book, movie, or experience that has had a great impact on you?
I'm a media consumer in that I never sort of remember titles and these sort of things. I remember phrases and contexts and everything.
We've had this issue with a few other guests as well.
And I'm the same.
Yeah.
I just see something, I like this, but then 2 days later, I don't remember what I saw.
I would like to recommend a movie, but I don't remember which one it was.
Yeah,
Exactly.
Yeah. Most effective. Let's say that the name Orwell has been on my mind for a round, but not the perfect answer.
Okay, we'll take it as it is. Thank you.
Okay, and then if we think about the discussion today, what is the main takeaway or one thing you wish people would take away from today's conversation?
Well, considering the sort of mix of topics that we've had, I guess the most relevant has been that I think we and others in our field have proven how feasible, how reliant, how capable cloud is in providing these critical services, like, for example, assisting healthcare. So I think that is like what I would really like to underline from this.
Brilliant. Thank you. Maybe to try to wrap up a bit of the rest of the conversation, correct me if I go completely off. But we've been discussing a lot about exactly like you said, how cloud can be an enabler in what you do and how you provide what you create to the end customers. Then at the same time, there's a lot of regulation going on, especially from your point of view in the healthcare industry, that is also changing rapidly, that you need to keep up on. And it's something that you need to be on top of to be able to create the kinds of services that meet the needs of customers today and tomorrow. But at the same time, having your rapid infrastructure as a code way of approaching it on top of a working cloud solution makes you able to usually securely and quickly scale into the situations and customer cases that when the needs arise, you're able to hopefully meet them. And well, we're looking forward to seeing Oiva Health, like you said, take over the world, because the help would be very much appreciated in many places, as we've come across during this conversation.
Absolutely.
All right. Thank you, Johannes, so much for joining us and for the conversation. It's been great to have this chat and get to know more about Oiva Health and where you guys are going next.
Thank you so much, and thank you for having me. This has been very pleasant. Thank you.
Thank you.
Thank you so much.